our topic today is maternal health for the incarcerated, where justice meets the womb. California has passed. We could go to the next slide. I don't really know where we're at. Let's see. Yeah, next slide. California has passed several legislative protections in recent years to ensure that individuals who are pregnant, postpartum, or reproductive age in custody have access to timely and appropriate care. These laws were created from the input of healthcare providers, formerly incarcerated people, legislators, and system professionals. So we're going to have a discussion about the laws that have been passed, the bills that have been passed through legislation or been ballot added that have received a vote. Not all of it is about pregnancy, but for me, the reason why I titled it Maternal Health is because every person with a womb, we experience different things that are protected in our laws when it comes to the incarcerated person. Next slide. So my name is Janet Hughes. I'm a policy doula, which means that I help advocate for policy. Full spectrum doula, which was trained by Sankofa Birth Workers Collective, and I also facilitate healing centered spaces, even just like this one, because there's a lot of policy that has come across the table that we're not aware of, that we need to make sure that every incarcerated person is receiving all of their rights or are aware of their rights, and the people who service them should be aware of them so that when they're asked upon, they can receive them. Uh, and I am the founder of Healing and Wholeness. So I am here to supporting birthing people across pregnancy, labor, loss, postpartum, and system transitions. I'm here because I helped create policy. I was a part of the team that created and helped pass the bill AB 2527 for pregnancy protections of those in custody. I am here for visibility, partnering with community organizations, clinics, and county systems to expand access to doulas. Expand the access for doulas for the justice impacted families. And I am here because I personally have a concern about care, not cages. So I show up to bridge law and the lived experiences plus healing so rights become care. Next slide. So laws in California started passing as far back as 2006. And this one was the no shackling ban, and it was amended in 2012. And so this ban, it bans shackling of pregnant incarcerated people during labor, transport, and postpartum recovery. It only allows restraints in documented reasons, which are justified by safety circumstances. So this is something that should be typically in writing. Uh, it prohibits leg irons, waist chains, and behind the back cuffs during pregnancy, and recognizes health dangers and trauma risk from the restraints. So, you know, first of all, I want to let you all know these are bullet points. I'm not going to go in depth because that would take the full hour, but I do, if any of these laws catch your eye or that you want to make sure being implemented, or want to make your patients, clients aware of, please review the full documentation about these things, because these are just snippets, you all, and there's several laws that I wanted to bring awareness about. So anything else or any conversation you want to have, you can always reach out to me and we can go into it further. Next slide. In 2011, AB 568, Assemblymember Skinner brought a bill about the hospital transport for childbirth. So this ensures timely hospital transport for laboring incarcerated individuals, establishes early standards for dignity in correctional birthing procedures, prevents obstruction or delays by custody staff, and coordinates procedures between the correctional facilities and the hospitals. Next slide. In 2016, AB 1433, Glazer, the Menstrual Dignity in Custody law, it improves sanitation and health for incarcerated menstruating individuals. It helps protect against infections and prevents trauma. It applies to county jails, juvenile facilities, and prisons, and it requires jails and prisons to provide free and timely menstrual products on request. Next slide. So these laws that I've shared so far were California's laws. These are laws that California passed. And then in 2020, the federal government then took notice to the Black maternal health that of the mortality rate of Black women dying during birth. So this has now become a national issue, and it then passed a law in 2020 called the Federal Black Maternal Health Omnibus Act. And this funds community-based organizations led by Black maternal health advocates. This also addresses social determinants of health contributing to Black maternal mortality. This law also expands Medicaid and WIC benefits, maternal mental health access, and perinatal workforce diversity. And this is including to the midwives, the doulas, those kinds of things. But this law also takes it a step further and includes funding for maternal health in the carceral system. So that also allows them to have access to doulas and no shackling. So now this is not just a California law that went back to 2006. It's now a federal law in 2020. Next slide, please. So from there, Senator Bonta knew about this law, of course, and then created one to bring that federal law to California. So AB 732, the Reproductive Dignity for Incarcerated People Act. It requires voluntary pregnancy testing at intake and timely OB appointments within 7 days. It mandates access to prenatal, postpartum care, vitamins, hygiene products, and lower bunk assignments. It formalizes written policies around pregnancy care in the jails and prisons, and it authorizes access to doulas and midwives to provide care inside the facilities. This law was passed, and it becomes one of California's landmarks omnibus-style reform focusing on the incarcerated pregnant person. So this is why 2020 was so pivotal in making this law that California then adopted it. But it also, I think, is where from my study, don't quote me on this, but I think it's correct. This is where our AIM comes into place. So AIM is now born out of this law. Next slide.
Can you, when you say AIM, do you mean the AIM initiative?
In California, yes.
Okay. I don't know that everybody here knows what that is. So can you just elaborate?
Ooh, okay. So can somebody help me? I think Deidre probably can help me, or Chantel, because I think the AIM initiative in California, it allows us to have really kind of funnel the money to the CBOs to actually take care of the maternal Black health. Is that correct, Deidre, for AIM?
I'm actually not familiar because I mean, it sounds like you might be confusing with the Perinatal Equity Initiative. Is it one or the other? I am not sure.
I don't know. You guys, because I'm misspeaking, let me double check with you and I'll clarify that for sure for you all. But these are the laws that I know are in place, but I also know that there are other, like Deidre said, other initiatives that are tied to these laws that have passed. Okay. In 2021, AB 65, California Omnibus Act goes into place. It establishes California Pregnancy Associated Mortality Review Committee. It also expands Medi-Cal postpartum coverage to 12 months for all birthing people. It requires detailed reporting on racial disparities in maternal health outcomes. So like this one isn't directly associated to the incarcerated pregnant person, but it creates it. This is kind of becomes a foundation for more laws for the incarcerated pregnant person. It supports funding and expansion for community-based doulas and midwives, and it calls for investment in culturally congruent maternal care and data equity. Next slide. In 2022, Prop 1, the Reproductive Amendment, this is where it amends California's constitution to guarantee the right to abortion and contraception. It enforces that all Californians, including incarcerated individuals, retain reproductive rights. It prevents jails and prisons from imposing policies that obstruct access to abortion. And it aligns California law with the post-Roe urgency for reproductive justice. Next slide. And this is the bill that I worked on. So in 2024, AB 2527 was passed. Solitary confinement, reduced solitary confinement, and pregnancy protections. It requires access to clean drinking water, a minimum of 120 ounces, and daily high caloric meals. And this was in alignment with WIC, you all. It also I don't know if that's the AIM I'm talking about, Deidre. That's one I want to present about, but AIM, I think it's the AAIM.
I know you're
That I
okay.
know you're talking about.
That we know. Yeah. Okay.
Yes.
Okay. That's the one I was thinking. Sorry,
My
I
bad.
wasn't clear.
This one also has to do with community-based care upon reentry, that I just shared with you. So that project is, I feel like that's through LA Public Health, and they are providing doulas at no cost to the community as well. Then this predates the Medi-Cal benefit that's now in effect, but that was there were some particular tenets of the people who had to be a part of the program, but they had very much like a doula program, the doula program that we have here in the Inland Empire. It was not attached directly to Perinatal Equity Initiative. And again, it's a doula access program for individuals in LA County. Yes.
Okay.
About.
So that is some of my research, which I didn't really include because I really wanted to get you all familiar with the state laws. But even in my research, as you brought up LA County is kind of a forerunner of things that deal with maternal health. San Bernardino County is kind of second, but they're kind of far behind than what LA County does. And Riverside County isn't doing any work, towards, and this isn't, I'm not even talking about incarcerated. I'm talking about just as maternal health as a whole. So I kind of kept that out because it wasn't within my scope of the incarcerated pregnant person. But when you look at maternal health as a whole, LA County is really working towards that. But I do know that we have several board of supervisors who are very invested in maternal health, as well as and I think that should be the goal for San Bernardino and Riverside, is to get their boards of supervisors involved to get more laws passed for maternal health as a whole, and then, dial it down to the black and brown community has great disparities, as well as the incarcerated pregnant person, because most of them are within those counties. But that's a whole nother conversation. Okay, so within this AB 2527, we were able to. Now, I just kind of want to give you guys a little bit of history. We wanted no solitary confinement, but our bill was kind of hijacked by the author. So I'll just tell you that was an experience. But they negotiated a reduced solitary confinement. So it ensures facilities provide written information about community-based supports and doulas to the incarcerated person. It strengthens reintegration support through discharge planning requirements. So there are things that, you know, the child, once it's born, needs to go somewhere. So this is a part of that was a part of our thinking in this is where is the plan? How is the child taken care of? Where does the child go? And then it limits the use of solitary confinement during pregnancy and 12 weeks postpartum, with documentation uh, to be there. So next slide, AB 24. In 2024, AB 2740, we have the Comprehensive Prenatal Support in Custody law. It mandates regular prenatal checkups, vitamins, and labs for confirmed pregnancies. It permits doulas or support persons to be present during labor and delivery when possible. It supports postpartum planning and aftercare to reduce maternal health disparities, and guarantees transport for labor and emergency uh, prenatal care. So these are the laws that have been passed. And from here, the other part is making sure that everyone is aware of these laws so that we can actually see that the incarcerated pregnant person is being cared for in a manner that the laws allow. And so that's why we're here, and that's what we're meeting for, and to make sure that, everyone who services this population is aware of what has been passed. And if there are any questions, I'm open to answer them.